Hello, Henda Sanwanani, and welcome to another episode of the Joburg Reporter podcast. And in this exclusive interview, we're interviewing a highly skilled doctor, Dr. Edward Ngwenya. He is a plastic and reconstructive surgeon based in Johannesburg. Join us for this exclusive tour of his practice in Fourways at Lifeways Hospital, Block C39. Stay tuned for this amazing tour of this state-of-the-art aesthetic practice. Okay. Thank you so much for allowing us into your space. Let's start by just a brief introduction of who Dr. Eddie Ngwenya is.
All right. Thank you for having me, and it's certainly a pleasure to have you over. My name is Dr. Edward Ngwenya. Generally, I'm a plastic and reconstructive surgeon. So we practice in two locations mainly. I'm based here at Lifeways Hospital, and that's where we're practicing. I've got my practice here, as you would see, and we'll explore more on some of the things we do. But I also practice at Daveyton Medical Center, which is just off the highway, the OR Tambo Airport, in Kempton Park, and that's where we'll see also patients there in and offer a similar, you have a similar form of offering that we give here.
And then take us back into your background. Where did you grow up? How was your educational journey? And how did you decide to become a doctor?
Okay, throwbacks, eh? Yeah, sure. So I was born here in Johannesburg. Well, we call it Joburg even when it's out there. But rather, I was born in a township in the East End called Daveyton. I was born in the East End. Daveyton Clinic is where I was born. Born in a family of six, being one of the six. So I had my mother, my father, got an older sibling, girl, and then I'm the second born, and there are then two after me, a girl and a boy. And yeah, it was, a very close-knit family. Mom, dad, both teachers, who then also excelled, through their educational, endeavors, and ended up in various different platforms, with that. But it was a lovely childhood that I must say I had, fond with family around. We're a close-knit family. I then, of course, studied there and decided to then do medicine, study medicine. That was it was quite an interesting decision because I had to choose between law, which I liked, and was unsure, and medicine. But I realized soon when I was in high school that I started to enjoy biology, and physiology and all that's in there, and I excelled in that area. And so then I decided, no, you know what, I think that's something to go for. Of course, there were the aesthetics of being a doctor. We don't have a doctor. We've never had a medical doctor in my family. And so I would watch that, and then they had those beepers. So the doctors had the beepers, and they would call, Doctor Who, Dr. Scott, etc. So I said, no, one day I want to have a beeper. But as soon as I qualified, there were no beepers. So, but certainly, it was my love for biology, and for the human body, that made me get in. And that's when I went to University of the Witwatersrand, where I studied medicine.
You did very well as a student. I think you were in the top 15% in the country academically. Tell us about that.
Sure. I would say when I look at my trajectory, from primary school, high school, I would say I was fairly on the average percentile. generally. You perform, maybe, let's say, I was not the highest performing, neither was I the lowest. I was between average and that, and mainly because I was involved in many other things. And it's only later on when I then realized that, you know, where when or if I put effort into something, then I can excel in that. And biology was a motivator because the teacher made us sit according to our marks in class. And so therein, I decided, you know what, I don't want to sit in the middle, let me study. And I was shocked. I went to the front of the class. So I said, okay, you're capable of that. So and so I then realized intelligence is one thing. But intelligence won't take you that far. It's hard work, and it's consistent hard work. And so when I entered medical school, and that was my approach. I was not that, bookworm, just sitting there day in, day night. I mean, there's life outside of medicine. And there were many sporting activities and social activities I would be involved in. I was there in the SRC. I was the first, in fact, a Black Medical Student Council president at Vets University. And so I was involved in all those factors, yet I kept my work ethic. And I studied and I excelled. And after that, I then went into specializing. I specialized in general surgery, wherein, as you've indicated, I excelled in the top 15% of the country in general surgery. It takes about 5 years to specialize in that. So I'm a general surgeon, but I also did another specialty, which is unique. So most people would be specialists, but I've got a double specialty. So I'm a general surgeon, but then I also specialize thereafter in plastic and reconstructive surgery, and therein excelled. So what would I say it was? Intelligence. I would say, look, it's hard work. And do I believe anyone can do it? I think anyone who's determined can do much. You just have to have that definitive of purpose. You need to, have that hunger and be consistent every single day. If I said I'm going to read this, I would read it and I would go past that. And that puts me, in those academic positions where it did. Yeah.
Plastic surgery. Which year did you decide to specialize in plastic surgery? And I'm just wondering, at the time, South Africa was still a country where, everything was still very traditional. Plastic surgery must have been a new thing. How was it received when you decided to study it?
Look, and that's quite interesting. I didn't know about plastic surgery as much as I do now. When even I was in high school, I didn't know about that. And so it's always been something that's been, quite abstract, that, it's overseas, it's in other countries, and often known, for its more cosmetic appeal. The boob jobs, the Pamela Andersons, Baywatch, and Dr. Nino, etc. Those were the things that we often used to see. However, plastic surgery is diverse. And I'll tell you, when I went in, it's still extremely, number one, it's difficult to specialize in anything. And there's only a few people who are allowed to specialize. So you have to write a series of exams, you have to attend interviews, and then be considered for specialization in any field. And therein, there may be there's so many of you, some who may have, more experience, but they look at all the marks and have that interview, and then you can get in. So there are certain, what may I say, processes and variety of steps one has to reach to get there. So as a general surgeon, and I'll tell you what then happened, where I specialized was in UP, the University of Pretoria. And when I went into plastic surgery, I think generally, there were three of us. in training there, because of the limitation of posts. Even now, they're quite limited. And remember, once you're in, only after 5 years can another one come in, should you then go through. So that's what puts that restriction, and the amount of people who can train. And so, as a general surgeon, I realized that I loved breast surgery, breast cancers, and those are the things that I would operate. And therein, I realized, we used to prioritize life, which is good, but the quality of life, we didn't take much in inverted commas consideration, and I'll elaborate on that. When someone's got breast cancer, we did mastectomies most of the time, and remove the breast. But I've learned there's no single female or male who'd like to walk around dismembered, disfigured, and only having one breast. So as much as you're alive, it's not good enough to say be happy. The quality of life thereafter matters. I'm not putting socks. So that's why I entered plastic surgery, to reconstruct that. And so was it easy? No. I mean, when I got in with the very good marks. I went into, the specialty, being accepted at 3 different institutions, chose UP, and yeah, certainly one was able to then get in, go through the process, and qualify. Sadly, when one looks, I mean, it's still a small field, still few of us, people of color, quite few, because I can very much tell you, even in UP Pretoria, when I did qualify after their long history, I was the first African black plastic surgeon to qualify for the University of Pretoria, and that's how it's been. And thereafter, how many have qualified from there of color? Maybe a handful, if I could count them in one hand. Maybe not, maybe in one hand. They may fit. So it's still, there were those challenges which still are there. However, you can break through them, and I did. Yeah.
And NHI.
NHI.
What are your thoughts on it?
NHI. Look, I'll give you my personal thoughts. I've said in a lot. I know the NHI from when it started in 2010. We're talking about the Green Paper. I was in the South African Medical Association. I've been the vice chairperson of the South African Medical. So I've been involved in the processes and think tanks, as they call them. My view, we certainly need universal health coverage. Universal health coverage, and I can tell you, anyone and most healthcare professionals will tell you that universal health coverage is a must. And what is universal health coverage? It is equal access for all, to be able to get the care that they deserve. Now, let's then go into, then we've agreed that is how. Now, the proposed in South Africa vehicle to get us to this is the National Health Insurance. The funds therein. So it speaks of a fund wherein we all pool money together, and then everyone can access healthcare equally so. But it's very scanty on detail, and the devil's in the details. So simply to have a fund, it's not sufficient. I'll tell you the situation right now in SA is that, by the way, you and I are both contributing to the tax, to the fiscus. And so I have an opportunity, if I want to go use any state facility, you have that right. You are paying for it. But then after your tax, you even go further and take out money from your own pocket to get medical aid or to see a general practitioner because of the limitations there. And those limitations have yet to be addressed. Facility, the level of care. So why are we not going to state, or why are you not going to state? And I've worked in state all my life. I'm passionate about state because of the limitations there. You don't want to wait forever. You've heard stories. You've heard that there are resource limitations, and it's a fact there are. And facilities, where else can you go? Name one state hospital from here. It's still the very same ones that you know of, and very few, if any, new academic centers. So do we need universal health coverage? Yes. NHI? No, we're not ready for it. It's a proposed fund that's saying, look, here, put money together, which you already are, and we will manage it. And so, then you can access healthcare should you want to. Well, I can access it now, but do I trust it? And until we get trust, we're not ready for that. Until you say, everyone, it's now public healthcare in inverted commas, trust us. I think we have not reached that point. And last but not least, those who hold the fund. The track record right now of governments and being involved in the processing and knowing, I think South Africans have very little trust, to be quite honest.
Talk to us about where we are right now, this very, very beautiful building. When was it open? What services do you offer? Yeah.
Sure. So right now you in my practice at Lifeways Hospital, room C39. This is where I am, my suite. And herein we offer, as my profession is, anything related to plastic and reconstructive surgery. Now, what's the two? There's the cosmetic part, wherein one looks at now the anything from body, face. So as much as liposuction. They all talked about BBLs. Those are the things we offer. Those are the things I do. Your breast lift patients who've had saggy breasts after kids or whatever, breast lift, breast reduction, a huge issue in SA, in our profile of patients. So anything breast, body related, liposuction, those may be surgical or invasive, cosmetic procedures that we do. Then there's reconstructive. Now, what's reconstructive? Reconstructive, the difference is someone who comes in and has a defect, either through trauma, through some form of surgery, cancer, and needs that element or that particular region reconstructed or reformed, to use an easier word. And therein you deal with burns patients, cancer patients, whether it's breast cancer, skin cancer, cleft lip and palates. So there's a wide range. So we offer majority, my strong point is breast reconstructive surgery, and cancer surgery, which we call oncoplastic. But I must say my practice does significantly, a high volume of cosmetic surgery. Now, then there's non-invasive or minimally invasive or non-surgical procedures that we then do. And that's why there's the staff complement, as you've met in my practice. We've got the somatologist, the therapist, because after that, there are patients who need botulinum toxins. Some may want fillers. Some may, have issues with the dark spots, chubabas, we used to call them, acne scars, and so many, or scarring, keloids. You just scar in a way that you don't want it. So we fix all of that. So welcome to my rooms. Our practice at Lifeways Hospital. So here, as you've seen, this is our office. This is where we do our consultation. So as someone walks in, first they are met in front, as we've explained, and then they come through and have a seat, and then this is where we have our dialogue. And then now, of course, is going to come the examination. So after you see someone, one then will need to do an examination of the patient, and then we examine the patient. Generally gets dressed into one of the different sizes of gowns, which are always changed, of course, hygiene, very important. And here we'll then do the examination, under privacy. This room we then also use, by the way, if we need to do procedures. So you may find, as we have, our different toxins, botulinum toxins, fillers, etc. So all of these will then be done here. I work with my therapist, who then, of course, assists in getting everything ready. Now, most important with every patient, you'd always need something like this. So we then have this, which is a screen, then one drops, where we can then take the before and after pictures on different sizes with a good background. And so we're able to then determine and compare between the two. So this is certainly one of our other rooms here where we examine. Now, it may so happen one then needs to be operated. We then work through all the details, and then we operate in a theater within the hospital. Now, there's also patients who require minor surgery, wound care, minor surgery, cuts, liposuctions, etc. All those things that we do. Then we have our anesthetists who then come along and then do that. And here we then do. So this is our minor theater, and in this theater, then of course, it needs to comply. We have oxygens and adjustable beds, etc. And yeah, all the different utensils and tools that we need to do. Now, remember, whenever we do anything, it's always under sterility, because we're dealing with human tissue here. And so behind, of course, there's always a workroom, as you see. Actually, a restaurant, and there's always a kitchen where there's clean things are happening at the back. So this is where we keep. It's our sluice room. We sterilize. We've got an autoclave. It sterilizes equipment and make sure everything is clean. And then here we then do all the work, under extraction, ventilation, and all of that. And I have my anesthetists, and this is what they need, because they need to have all the variety of things. I mean, if you need to bag a patient, this is what they need to put the patient, the drips, and then all the things. So this is our anesthetist trolley. Of course, we have our drum trolley. Must always have something like this, which is not. And there, the certain high scheduled medications you can be. But yeah, this is our operating room.
I'm allowed to go there?
Sorry? Sure. Come through. Let's hope it's clean now. Okay, let's see. What do we have here? Yeah, so you see as you can see, that busy sterilizing some of the equipment. And as you can see, our strict guidelines that each and everything needs to have X, Y, Z. And we've got our autoclave machine. This is actually the fastest autoclave that's currently there. And so would then autoclave basically whatever utensils we're using. And in this room, everything is backed up. We've got UPS, all the power, so we'll make sure that we've got no interruptions there in it. Depending on the ambiance, then when we want to focus in an area, I'll then generally switch off the lights, and then I would wear one of my I can show you this, headlamps. Wherein then I can then focus specifically in that area that one needs to work in. But certainly remember, this is serious stuff that's happening, and you're working with a human being, a patient, and we need to meet all standards. All right. So this is how mine sure. And then also to our area here. So basically on this one, okay, you can see this is Lindy, our esthetician, and she's basically preparing everything for a patient right now. So this is where we then do a lot of our surgeries. We took over. So she's preparing it. Then we've got our bed here, which is adjustable, and then every patient will get a picture taken, get a gown, you prepare, in the bathroom next door, and then we have our laser machines, our different equipment that we use for a variety of our offerings. Included therein also would have our own range and all different ranges that I use. We do also, manufacture our own products. We've got an anti-aging range, which I can show you actually there in front, all of them, and that we've actually from scratch made ourselves. And we know all the active ingredients, tested every single thing. So we also getting that. Yeah.
Is there a demand? I would assume there is a demand for anti-aging products. Yeah. And you've been seeing it in this practice as well.
Make no mistake, definitely everywhere. I mean, you only need to go to Instagram or whatever to see that. Everyone is trying to limit or lessen the natural effects of aging. Aging is good. We don't want to stop aging, but we can age appropriately. So this is what then it is. It's all about our fine wrinkle. The people who don't like you, see you end up drooping here. You have scars, you have acne scars, you have all of that. And that's what you hear for alopecia. hair, like our lasers were to do hair removal, and tattoos. You made a decision that day in varsity or whatever, and you wrote, whoever's name. And hey, things are no longer with whoever you've written, and so then laser, we use that for that. But anti-aging, make no mistake, there is this demand, or this push to remain as young and as youthful, as possible, I guess, for various reasons. Be beautiful, stay in the market longer, anything, yeah. And what's on your side? You've seen that quite a lot.
We do see that quite a lot. You see a lot of people, well, like he said, aging is very natural, but you still want to look like presentable. So if you have like those fine lines and wrinkles, there's things to sort that out. You do your lasers, you do your Botox, you use like our Botox light peptide in our eye serum, so that helps. So people use to do that just to look presentable. We all want that.
Who doesn't? Comes at a cost. Unfortunately, what doesn't? Of course, cream is not for free, right? Yeah, so that's the extra steps then we had to get. And I guess maybe some entrances, barriers to entry in these fields become those. So many people go to places where they don't have the right equipment, or they're saying a product, and you don't want that. You want a diagnosis. Once you have a diagnosis, we are treating you using the product. Not that we have a laser machine. I mean, it's 200 rand for a laser machine and all other things. But you don't sell the treatment. You treat the patient with what you have. And I think that's what we do. But, a lot of people out there are pushing because it's revenue. But, we take a different approach. We diagnostic and we treat the diagnosis. And the diagnosis, remember, the patient's not coming in with wrinkles or whatever. It's a patient with wrinkles. So that patient's got to be treated holistically. And that's what we're into here. Holistic care.
You look good as well. Do you have your own doctor or you are your own doctor?
By the way, I use my products. I use these products that you made. I mean, if you're not gonna try it on yourself, then trust me, and my treatment, it's from my own team here. I've mentioned our therapist, our esthetician. She's an expert in her field. I don't hold the monopoly of wisdom. And certainly in the area where she works in, she's the expert, and I also submit myself there and undergo treatment. So certainly, you cannot be a jack of all trades and treat yourself in everything. But whatever we sell here, or whatever we offer here, we've tried and tested, and I've tested on myself and continue to.
Looking to do any cosmetics? Visit Dr. Ngwenya's practice at Lifeways Hospital, Block C39, and at Kempton Park Medical Center. See you there. He awaits to welcome you.